Blood pressure, BP. Normal blood pressure is vital to life. Without the pressure that forces our blood to flow around the circulatory system, no oxygen or nutrients would be delivered through our arteries to the tissues and organs. What do blood pressure numbers mean? Blood pressure is measured using two numbers. The first number, called systolic blood pressure, measures the pressure in arteries when heart beats. The second number, called diastolic blood pressure, measures the pressure in arteries when heart rests between beats. If the measurement reads 120 systolic and 80 diastolic, would say, 120/80, or write, 120/80 mmHg. Why blood pressure is measured in mmHg? The abbreviation mmHg means millimeters of mercury. Mercury was used in the first accurate pressure gauges and is still used in medicine today as the standard unit of measurement for pressure. How blood pressure is measured. A doctor or nurse will measure your blood pressure with a small gauge attached to an inflatable cuff. It's simple and painless. The person taking your blood pressure wraps the cuff around your upper arm. Some cuffs go around the forearm or wrist, but often they aren't as accurate. Your doctor or nurse will use a stethoscope to listen to the blood moving through your artery. They'll inflate the cuff to a pressure higher than your systolic blood pressure, and it will tighten around your arm. Then they'll release it. As the cuff deflates, the first sound they hear through the stethoscope is the systolic blood pressure. It sounds like a whooshing noise. The point where this noise goes away marks the diastolic blood pressure. Symptoms: dizziness or lightheadedness, fainting, blurred or fading vision, nausea, fatigue, lack of concentration. Causes: alcohol and tobacco products, medicines, pregnancy, not being physically active, being overweight or obese, family history, too much salt, sodium, in your diet, too little potassium in your diet, some medical conditions, such as diabetes. Types of BP. There are two types of BP: high blood pressure, HBP, or hypertension; low blood pressure or hypotension. Hypertension. Hypertension is called a silent killer. Most people with hypertension are unaware of the problem because it may have no warning signs or symptoms. For this reason, it is essential that blood pressure is measured regularly. Types of hypertension. There are two main types of hypertension. Primary, or essential hypertension is the most common type of hypertension. For most people who get this kind of blood pressure, it develops over time as you get older. Secondary hypertension is caused by another medical condition or use of certain medicines. It usually gets better after you treat that condition or stop taking the medicines that are causing it. Complications. Uncontrolled hypertension can lead to complications including heart attack or stroke, aneurysm, heart failure, weakened and narrowed blood vessels in your kidneys, thickened, narrowed or torn blood vessels in the eyes, metabolic syndrome, dementia, trouble with memory or understanding. Hypotension, low blood pressure. Low blood pressure might seem desirable, and for some people, it causes no problems. However, For many people, abnormally low blood pressure, hypotension, can cause dizziness and fainting. In severe cases, low blood pressure can be life-threatening. A blood pressure reading lower than 90 mm of mercury, mmHg, for the top number, systolic, or 60 mmHg for the bottom number, diastolic, is generally considered low blood pressure. Treatments: diuretics, ACE inhibitors, alpha blockers, angiotensin II receptor blockers, ARBs, beta blockers, calcium channel blockers, central agonists, vasodilators, combination medications. Prevention: getting at least 30 minutes of physical activity a day. Not smoking. Managing stress. Eating a healthy diet, including limiting sodium, salt, and alcohol. Keeping a healthy weight. Reducing salt intake to less than 5 grams daily. Being physically active on a regular basis.